James, a knee, foot and ankle specialist, and I've been providing advice to patients for over 10 years on what footwear to wear for pain relief. If you're experiencing posterior tibial tendonitis, please let us know in the comment section below, and if you try any of the shoes that we recommend, please let us know how you get on. So the first shoe that we'd recommend is the Hoka Gaviota 4. It's one of Hoka's stability type shoe alongside the Hoka 6. This shoe has a 4mm heel drop, so the difference from the back to the front of the shoe. It has a J-frame support, so the darker grey that goes around the front and towards the inside of the shoe. And it comes in a variety of widths, so normal width and a wider width. The reason that we recommend this shoe is that the J-frame helps provide support on the inner aspect of the foot. If you think that most pain for posterior tibial tendonitis is on the inner ankle or inner aspect of the foot, unlike most other shoes that have a medial post, this tries to guide the foot throughout the gait cycle by providing support throughout the shoe on the inner aspect. It is one of the heavier of the three shoes that we'd recommend, but it has some of the most unique type of support, and we found that it really gives patients relief if they're suffering from severe symptoms. The second shoe that we'd recommend is the Asics Gel-Kayano 30. This is a staple of the Asics collection and their most stable shoe. Unlike the Hoka, it has a traditional medial posting on the inner aspect of the heel. This helps to lift and support the arch of the foot, put a slight tilt on the heels so that when you run, if you have excess movement inward, it helps to control that motion, reducing the stress placed on the tendon. It's a lighter shoe than the Haaka 6, providing a different type of support. Typically, we recommend it to patients who have light to moderate symptoms of posterior tibial tendonitis, and one that we typically recommend to our runners as it's slightly lighter and a bit more responsive when you're trying to push off. The third shoe that we'd recommend is the Brooks Adrenaline GTS 23, Brooks' most stable shoe. It's the lightest of all the three shoes that we'd recommend. It also has the firmest cushioning. So the Hoka 6 has very plush, soft cushioning, a little bit firmer and responsive in the Asics Gel-Kayano, and the firmest of all three in the Brooks Adrenaline GTS. It has a 4D guidance system to provide stability rather than a traditional posting like the Asics Gel-Kayano or the J-frame of the Hoka 6. With this guided system, it acts like bumpers either side of the foot, so when your foot hits the ground it tries to keep it nice and stable and within that tram line so that your foot doesn't deviate too much inward and place too much stress on your posterior tibial tendon. It has the highest stack of all three trainers, so that means the difference between the height at the back to the front of the shoe is 12mm. It's 10mm in the Kayano and 5mm in the Haaka 6. It can be helpful for posterior tibial tendonitis as lifting the heel and providing a little bit of support on the inside of the foot helps to shorten the tendon, offload it and ease your pain. So if you're looking for a firm, responsive trainer that doesn't give as much cushioning as something like the Haaka 6, then this is for you. As posterior tibial tendonitis is caused by an overload, the shoes make a big difference. One of the things that we'd also recommend is carrying out posterior tibial tendonitis strengthening exercises. It helps condition the tendon, making it more tolerant to load acceptance, and we've linked some videos below in the description. The second thing that we'd recommend is that you could try using posterior tibial tendonitis insoles within the shoe. The posterior tibial tendon attaches onto the arch of the foot, so by lifting that upwards, it helps offload it during the gait cycle and when you stand. This can help alleviate your pain. And the final thing that we recommend to our patients, especially in severe cases or in acute phases, is that you tape the posterior tibial tendon. So normally we look at taping the ankle into slight inversion, combining that with a stable shoe, plus or minus the insoles, and then we'd work on the exercises for 4 to 12 weeks. If you find the video helpful, please drop us a comment below, like and subscribe to the channel, and hope to see you again next time.